Hello and welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. I'm Chuck Jones with Synergy Broadcast, and as always, we're joined by our expert guest, Fran London. Hi, Fran.
Hi, Chuck.
Fran is the patient education specialist at Phoenix Children's Hospital in Phoenix, Arizona, and she's also the author of the book No Time to Teach, which we use as our source of inspiration here on the Patient Educators Update. And Fran, we're going to talk today about a topic that may be near and dear to your heart a little bit, because it may be why you wrote the book, but it's what to do when patient education becomes frustrating. We've had some comments here recently from both customers of ours and non-customers who watch the show, and they're kind of venting. They're saying, we're just beating our heads up against the wall. We're dealing with patients that don't seem interested. They don't seem to care. They don't see the point in us trying to educate them. They don't see how it affects them. They just want a pill or something similar to just, and let them go. And some of them, even no matter how hard we try, they're not getting it. So there seems to be a high level of frustration, probably brought on because a lot of the push towards patient education to reduce readmissions and things of that nature. And so hospitals are trying all these crazy things, except for maybe just traditional patient education, to fix the problem. And so we're seeing it bubble up just a little bit. So I thought it might be appropriate to get some strategies and or tools and ideas from you on what nurses can do to help overcome some of these issues with patients that either don't seem to care or don't get it or whatever. So what do you think?
I agree. I've been in those situations when it appears that the patient just doesn't care or doesn't want to know or is resisting whatever it is that you're offering. And that's probably due to their past experience or their point of view. So the thing I would like to emphasize is when you feel that frustration, when you're in a situation and you're starting to get a little frustrated, especially when you feel like you're obligated to teach and you can't move forward. I've got my cue here. It's a red flag.
Yeah.
Frustration is a red flag. And that means you need to pay attention. Mm-hmm. And when you start paying attention, what that means is whatever you're doing is not working. So you need to change your approach. And the best and easiest way to figure out how to change your approach is to go back to assessment. Mm-hmm. So if you can find out what the patient is interested in, what they do care about, what they are motivated by asking those questions and having a conversation instead of pushing the teaching at the start, you might be able to find an in, something they care about, something do they want to live to see their grandchildren or whatever it is, find that in so that you can modify how you're presenting so that you can get through.
Okay. Well, let me interpret what you just said and boil it into a little list if I can. I think the first thing you're really saying is stop and step back. Because if you're beating your head against the wall, continue to beat your head against the wall is only going to give you a black eye. So stop and step back. And then to go back to assessment, to revisit and see by listening and see what have you missed that might be the key. And then as you just mentioned, do they want to live to see their grandkids or things of that nature? You're getting far afield from the point at hand, which is to get better, and you're looking at life experiences and perhaps what their goals might be. And that's something that I've never experienced anybody ask me in the hospital. They just ask you how you feel. Do you have any questions? So you're basically saying you got to kind of take a holistic approach and look at the whole person and really dig in and really ask good questions.
You got it. Absolutely. Yeah.
Okay. Now, something you have mentioned in other episodes is it's important to understand what they know and what they believe, because that can be an obstacle.
Right. Because if you're presenting something that is against what their understanding is, they can't hear it because they're thinking you're wrong, and they don't understand it. So you really have to take that time to find out where they're coming from. It's not a waste of time. I know people think it's, I have a limited amount of time to teach, so I can't spend time doing that. You can see the frustration doesn't get you anywhere. So this is the only way you will be able to move forward. So it actually saves you time because you're not doing things that are ineffective. You're actually moving forward by finding out where they are and what they're thinking and what they believe, so you can build on that and correct misunderstandings.
Yeah, and that makes sense. And if they have something that they just you've said and they just don't believe, you're never going to break through until you see it through their eyes, more or less.
Exactly.
Okay. Now, from the let's consider that the mental emotional side of it. There's also the physical side of it. Are they physically able to do some of the things that you need to do? And if I relate it to a story in your book, there was a youngster who kept coming back to the hospital with lesions on her legs. And it wasn't until somebody dug a little bit deeper into the home environment that you found out what was going on. You want to relate that story? Do you remember that?
Yeah. She had spina bifida, and she kept getting infections on the front of her legs. And we kept teaching about wound care and protecting yourself when you can't feel what's going on. And she seemed to understand the teaching and would go home and come back again with an infection until someone asked about, what does she think is going on in this situation? And she understood exactly what was going on because her home hallways were too narrow for her wheelchair. So instead of using her wheelchair in her home, she would flop herself on the floor and drag herself around.
Yeah.
And that was what was causing the abrasions on her legs that got infected. So once we got her a new wheelchair and fit her house, everything was better.
Yeah, excellent. Yeah, that's a good example of that. And I know that when my mother was still living, she had Alzheimer's, and there were lots of things that she couldn't physically do and/or physically remember. And the nurses would talk to her like she was all there, but she wasn't. And so they would tell her, do this, and she would just kind of shake her head, yeah. And then when they left, she'd say, what did they say? I don't know what they were talking about. I said, don't worry, Mom, I got your back. Because that's all you could do. I mean, it's just one of those things. They weren't digging deep enough into the situation. Now, also another topic that you've talked about is looking at some physical signs from the patient. You can see signs of stress and other things when you look at them, tension. How does that play in?
You have to pay attention when you have the conversation because you will notice. They're gazing off, they're distracted, they're not listening, they're not paying attention, they can't pay attention. And why waste your time continuing on with your teaching if you could tell it's not going to get through? Yeah. So you could always stop and acknowledge and say, is this a hard time for you? What's going on? Or maybe their reaction is because you've said something they disagree with or they don't understand and they can't follow you anymore. And until you ask those questions, you're not going to know. And you have to, it's an awareness of being there right in the moment, understanding what's happening, that saves you time in the long run and actually gets the teaching done in a way where the patient can learn new behaviors and actually apply them.
Yeah. I'm going to throw in an example totally out of left field because it just dawned on me what some of the things you're talking about. I'm a big foodie. I love to cook. And so I watch a lot of shows on the Cooking Channel and the Food Network. And there are two shows that they have that are almost parallel to what we're talking about. One is called Save My Bakery, and the other one is Restaurant Impossible. And they're both situations where these are going businesses that are failing badly. And so the host of the show comes in and without any preconceived notions starts digging into everything, asking a bunch of questions, listening and observing, and they pretty quick get to the source of the problem. Invariably, they have episodes where the owner doesn't believe them, thinks what they're doing is perfect, and just refuses to listen. And it's a very parallel situation to what we're talking about. So if somebody would like to see a mirror image of what we're talking about, watch one of those shows.
That's a great analogy. Absolutely.
Yeah, because it just
Same
really,
scale.
it really gets to the point in a different environment. But you can see it. And I was watching one of them yesterday, and my wife kept calling me to have me go do something. I said, in a minute. I wanted to see how this thing was going to end because it was not going well. And eventually the guy came around and everything was okay. But it's that point of listening and understanding and paying attention and digging in makes a big difference.
And it's the same thing in our situation, except that the patient's in the hospital because they didn't do what they needed to do. Instead of the business failing, it's an illness. And now you just have to turn that around.
Yeah, so true. And so I guess the moral of the story is until you have really discovered the source of the problem or the issue or the situation or the environment, you're not going to break through. So that's where the goal's got to be.
Yeah, and frustration is your cue that you're not going in the right direction.
Yeah. And so when you get frustrated, if I can summarize it real quickly, the first thing you want to do is stop and step back. Next thing you want to do is assessment. And listen very carefully and ask good questions. Don't assume anything and explore everything. And if you do it that way, in the long run, you will save time because you will get to the source of the problem quicker. Make sense?
Yeah, that's perfect.
Okay, cool. Fun episode. Okay. Why don't you tell folks where they can find you online and get more goodies like this?
I've got a blog at notimetoteach.com, and I'm on Twitter at notimetoteach.
Okay, and your book is available at Amazon and other book resellers and retailers. It's available both in paperback and ebook form, and they can download it anywhere and everywhere. And it is also available for bulk purchase from your publisher, Pritchett and Hull, and their website is p-h.com, and you get a sizable discount for ordering a bulk purchase for doing like in-service and group training and things of that nature. And for folks that are interested in kicking up their patient education a notch by providing video and video on demand, please visit our website, synergybroadcast.com, and look for our patient education product we call MMDS, or Medical Media Delivery System. It's a great tool to help nurses be able to do some teaching and education when they're not always in the room. And it's a great way to engage the patient after they've watched the video to find out what they know, what they learned, and what you still need to help them with. So, Fran, thank you so much for your time today. This is an excellent topic, and I look forward to speaking with you again next week.
Okay. Bye, Chuck.
Bye-bye.